Greetings and welcome to ME 115, Week 8. This week we're going to talk a little bit about the healthcare plans, the different types. Uh, we want to start out, of course, knowing that there's a lot of choices when you shop for health insurance. If you buy from the state's marketplace or from an insurance broker, you'll choose from health plans organized by the level of benefits that they offer, such as bronze, silver, gold. Some even have platinum. Bronze plans have the least coverage. Platinum plans have the most coverage. If you're under 30, you may also be able to buy a high deductible catastrophic plan. Now, how are the plans different? Each one pays a set share of costs for the average enrolled person. Now the details can vary across the plans. They're not all the same. In addition, deductibles, which is the amount you have to pay before your plan picks up the 100% of your healthcare costs. Most of us will never reach the point where we don't have to pay a deductible, or not necessarily a deductible, but go to an office and pay our percentage ahead of time. And this varies also across the spectrum of insurances, with the least expensive carrying the highest deductible. So the more that our patients pay for their insurance, the lower the deductible. So your platinum usually covers around 90% on average of the medical costs, and then that means that the patient pays 10%. Gold would pay about 80% and the patient pay 20%. Silver 70%, patients around 30%. Bronze would cover 60%, and then the patient would pay 40%. And then there's catastrophic. And the catastrophic policies pay less than 60% of the total average cost of the care. Catastrophic plans must also cover the first 3 primary care visits and preventative care free, even if you've not met your deductible, or even if the patient has met the deductible. You'll see brands associated with the care levels. Some of them are large national companies like Aetna, Blue Cross Shield, Cigna, Humana, Kaiser, and United. Each insurance brand may offer one or more of the 4 common types of plans. Now we have healthcare maintenance organizations, or HMOs. We have preferred provider organizations, or PPOs. We have point of service plans. We have, which is POS. We have high deductible plans, HDHPS, and these can be linked to the health savings accounts, which are HSAs. Let's take a minute here just to look at the differences between plans, some of the plans. The Health Maintenance Organization, or HMO, delivers all health services through a network of healthcare providers and facilities. So with an HMO, you have the least freedom to choose the healthcare provider, the least amount of paperwork compared to other plans, and a primary care doctor to manage your care and refer you to any specialist you need, as long as they're covered by the health plan. And most HMOs actually require a referral before you can even see a specialist. Excuse me. Um, so what doctors can the patient see in the HMO? So they can see anyone that is within the HMO itself. If the patient sees a doctor who's not in the network, they have to pay the full bill themselves. Emergency services at an out-of-network hospital must be covered at network rates, but not non-participating you can be billed by the doctors that treat you in the hospital. Here's what you pay. Premium, which is the cost that you pay each month for the insurance. Deductible, that's your required amount that you pay before it covers the care beyond your essential benefits. When you've reached those amounts, then the health plan obviously takes over at 100%. You have co-pays, or what's called, or even co-insurance for each type of care. Co-pay is just a flat fee, like $15 to $25 that you pay when you get your care. Co-insurance is when you pay a percent of the charges for the care, for example, like 20%. These charges vary according to your plan and are counted toward your deductible. Then we have the PPO, or Preferred Provider Organization. With the PPO, you may have a moderate amount of freedom to choose your healthcare providers more than HMO. You don't have to get a referral from a primary care doctor to see a specialist. Higher out-of-pocket costs if you see someone outside of your network, and a little more paperwork than the other plans if you see somebody out, that is outside your network of providers. So what doctors can the patient see? Any that's in the PPO network. If you see, you can obviously go out and see another doctor, but you'll have to pay more. Here's what you paid to the PPO. Your premium, again, that's the cost that you pay each month for the insurance. Your deductible, you likely have to pay a higher deductible if you see an out-of-network doctor. Co-pay your insurance. Other costs, if your doctor charges more than others in the area, you have to pay the balance after the insurance, pays its share. Paperwork, there's little to no paperwork with a PPO if you see an in-network doctor. If you use an out-of-network provider, you'll have to pay the provider. Then you have to file a claim to get the PPO plan to pay you back. So that's where the paperwork would come in. Point of sale plan, or POS. This blends features of the HMO and PPO. So with the POS plan, you have more freedom to choose your healthcare providers than you would in an HMO. Just a moderate amount of paperwork if you see somebody outside your network. And a primary care doctor who coordinates your care and refers you to specialists. You can see any physician, that is in network and that your primary care doctor refers you to. You can see out-of-network doctors, but then you'll pay more, obviously. You pay the premium You pay the deductible and the co-pays or insurance. And when I say you, I'm really talking about the patient, because what we're doing is we're learning what these insurances do and what they require. Paperwork. If you go out of network, you'll have to pay your medical bill, and then you have to submit to your POS plan to pay you back. Um, High deductible health plan with or without a health savings account. Okay, you may be able to pay less for your insurance with the high deductible health plan, or HDHP, and with it you may have uh, one of these types of health plans: HMO, PPO, POS. Uh, Higher out-of-pocket costs than many types of plans. However, if you reach the maximum amount of pocket, the plan pays 100% of your care. But you have to reach that maximum amount of pocket. A health savings account to help pay for your care. The money you put into the HSA is not taxed and can be used tax-free on eligible medical expenses. What doctors can they see? It varies depending on the type of plan, whether they have the HMO, POS, or PPO. They pay the premium. The HDHP has the lowest premium compared to the others. The deductible is high. In 2016, deductibles for individual health plans that were capped at $6,850 for an individual plan and $13,700 for a family plan before the marketplace subsidies. Deductibles will vary on the variety of factors, including whether you buy your insurance on the marketplace or get it through the employer. Co-pays or insurance. You really review your plan's benefits carefully to learn what's going to be you'll pay when you go for medical care. And with the HDHP, or high deductible health plan, your out-of-pocket spending is capped. For instance, if you have insurance only for yourself, the most you have to spend in a year is about $6,450, and that's not including your premiums. If your insurance plan's for your family, the most you'll have to pay is $12,900 without premiums. And the totals include your deductible. If you reach this amount, the plan pays 100% of your care. Paperwork, it'll vary depending on whether you get care from a PPO, HMO, or POS plan. You just need to keep all the receipts so you know when you've met your deductible. So that's just a little overview of some insurance plans. Just read your material this week, get familiar with these terms, and work hard to get all of your work done on time. If you don't, you're only hurting yourself. I've made a post online about what happens when you procrastinate and put off your work, so read the announcement. Just make sure you sign on, you make sure your discussion questions are in on time, and then just sign on occasionally during the week to make sure that if someone else has posted their post, reply to them, and in turn, they're replying to yours, and it becomes a discussion. If you're just posting, it's a post. That's all it is. And then obviously you're only going to get the points for posting, which to me is a waste of time. I want my full points when I do anything. Have a good week, and I look forward to reading your posts, and take care.